And in the case of NHS England, what we've had in the NHS for some years now is effectively 2 headquarters. And if you compare the size of those 2 organisations combined, about 19,000 people, double what it was in 2010 when we were delivering the shortest waiting times and the highest patient satisfaction ever. So what we're doing by abolishing NHS England is making sure that we've got one head office, a smaller, leaner, more efficient head office, saving hundreds of millions of pounds to put towards the front line, delivering better care for patients and better value for taxpayers.
You said that you wouldn't do top-down reorganisation. Well, to some extent you're doing that now. But I just want to ask you very quickly about something else. Is it right that Jim Mackey, the head of the NHS England, has written to local health boards demanding that they produce plans for a 50% reduction in their spending?
In integrated care boards, yes, with a particular focus on management costs.
Cutting half?
We came, myself and Jim, are confronting a financial planning round for the year ahead where systems returned financial plans to us that would have involved a overspend between £5 and £6 billion before the new financial year has even begun. And I'm afraid this speaks to the culture that I identified before the general election, where the NHS is addicted to overspending, is addicted to running up routine deficits with the assumption that someone will come along to bail them out, in a way that, by the way, local councils would never be able to do.
Are you saying that the NHS, or the apparatus of the NHS, was basically wasting public money?
I think there's definitely examples of waste, inefficiency, duplication, and we're going to go hard at it. Look, even if the public finances weren't tight, and they are, but even if they weren't, I don't think even in the good times it's acceptable that taxpayers' money is wasted, because the money you're wasting could be spent on other public priorities, or the money that's being wasted could be put back into the pockets of taxpayers who would quite like some of it back. 50%